IBD 100% can impact mental health, and dare I say, mental health can 100% impact IBD. It is certainly a two-way street.
This disease has such a mental component to it.
If you have IBD, your mental health is impacted.
It's the uncertainty and the unpredictability of IBD is extremely frustrating. As humans, we like to have control of things. We like to be able to predict things. And IBD is very much uncontrollable and unpredictable. So there's always that element of living with that anxiety, even fear, of what's going to happen. And that perpetuates in the mind and can become very unhealthy, which is why it's very important that your IBD care should involve care for your mind and your emotions as well.
It's one thing to be in physical pain, but then the psychological aspect of coping of I'm still in pain, and the worrying of when's my next flare-up, what's this gonna look like?
Getting used to this new routine that you have to do and having to sometimes be away from your friends for a while in the hospital or taking time off work if that's where you're at, it's challenging.
There is the why me? What did I do? Why is this happening to me? What did I do wrong?
There's such a struggle to do certain things that are normal for somebody with IBD, certain things that are part of community, such as engaging in food, community gatherings. Doing activities are hard. Our nutrition can look very different. Our physical mobility can look very different. So those things that are just supposed to be fun and enjoyable and bring people together can actually be very anxiety provoking. And all those things can increase anxiety and depression for people and affect isolation. And a lot of folks may feel easier to just stay home. It may impact whether someone finishes school when they wanted, the work someone has. They may have to change their job because the work they're in may require them to be standing and they can't do that, or the bathroom may not be readily available. All these things really do impact your mental health, and I think it's really important to talk about and to just say, like, yeah, this is more than just a physical disease.
It's not easy to go through the day feeling lousy or going through the day feeling like you're just have no energy, can't get done what you need to get done.
I know for myself, it wasn't something I considered of like, maybe you should talk to someone about this, because I understood this as just such a physical disease and I just gotta get the symptoms under control. I just gotta get into remission, then I'm all good. This is a lifelong condition, and even when symptoms are in remission, it still affects us. We need to look at mental health in terms of wellness, just not that like crisis of like, oh no, things are really bad and now I need support.
I think sometimes we all downplay it too, or I definitely do, and oh really, it wasn't that bad. And then you look and you're like, oh yes it was. And it's easy, I think time forgets.
When you are given a diagnosis, whether that be IBD, whether it be cancer, whether it be chronic or just long-term, whether there's a cure or not, I 100% believe that not only should you be given a referral to a specialist that deals with that disease or that illness, you should also be given a referral for mental health. Some of the common mental health issues, definitely anxiety, and never-ending perpetual anxiety, depression.
So when I ended up in the hospital, that was a cyclical thing. So I knew I was in a flare-up. I had friends who were very supportive, but I was so fatigued that then I reached a point where I wasn't answering the phone. Well, now I'm going to cycle into more depression, and it was such a vicious cycle.
Depression can be for a lot of reasons. For me, it was the chronic pain. It was being diagnosed with something that didn't have a cure. It was the constant hospitalizations. It was having to be on so many treatments and watch them fail over and over and get sicker and then all the extraintestinal manifestations of disease.
We experience anxiety with planning ahead. We don't know in 2 weeks whether we'll be sick or not.
Eating disorders, struggling with relationships with food, especially for those folks with IBD who food really does significantly impact their disease.
The relationship between stress and my Crohn's is it's everything. I think all the flares that I've had, I think, can be equated to stress. And anytime, in any flare, big or small, it's all comes back to stress for me. I think that's the big trigger.
Anytime I'm really stressed, usually it is exams, or if I have a project, something like that, I immediately find that my symptoms pick up.
My biggest trigger is actually stress for me. So when I'm not well here and I'm not well here, I am certainly not well here. And alternatively, the other way, it's kind of what came first, the chicken or the egg.
Your body, your gut, even your brain, but it's your gut in particular, does not know the difference between a good stress and a bad stress. It's just stress, right? So I can be excited about coming down and doing this interview, but my stomach's going, oh my God, we're stressed. What's going on, right? So yes, there's a huge connection, and I always believe that. I've always known that.
It's unfortunate because somebody sitting beside me, might be under the same amount of stress, but their body doesn't make them run to the bathroom 20 times a day and lose a ton of weight. It's very unfair sometimes that stress is processed so viscerally.
As much as, you can, I think, help it with the food that you eat and exercise and the medication that you're on and those things, I think the big factor is always stress.